Hello, this is Dr. David Green, CEO of the Colorado Pain Network. The topic today is actually a question. Is my hip pain coming from a hip problem or a lumbar spine problem? Millions of Americans suffer from hip arthritis, with the pain often causing significant disability with limited ability to walk, exercise, and do recreational activities. Close to 300,000 total hip replacements are performed every year in the U.S. When pain is occurring in the hip area, it seems obvious to assume that the problem is actually occurring from the joint itself. But hip pain may actually not be coming from the hip. There may be an overlap in symptoms between hip arthritis and lumbar spinal stenosis. And as an individual ages, spinal stenosis is very common, just like hip arthritis, with both occurring from degeneration. What you see in the picture here is significant bone-on-bone hip arthritis. And actually in the other side you can see that there's a nice joint space as well. With lumbar spinal stenosis, what's happening is the arthritis in the spinal joints causes enlargement and then thickens soft tissue in the area, and a normal circular spinal canal becomes triangular, and nerve roots can get pinched and cause hip pain. How do you differentiate between the two? There are various ways to do this, but one thing that I just wanted to show you here is looking at the spinal canal from the side. When you have spinal stenosis, what you can see here is that there's disc bulging coming back and bony and soft tissue overgrowth in the joint. Normally this is the spinal canal, but look what's happening. It's getting pinched down considerably. See here, bone spurs from the front and the back, and pinching occurs. And then once again, looking at an arthritic hip, a normal hip you can see a joint space here, but in the arthritic hip you really can't see a joint. There's some cysts, sclerosis or hardening of the bone. Okay, so obviously what you want to do is get imaging studies to look at the pelvis to see if the hip joints are arthritic, and then if the question is if the spine is involved, an MRI. So first of all, history, the area of the pain, duration, when does it come, when does it go. Interestingly enough, both hip and spine sources of pain can cause referred pain down the leg. I mean, you can have pain in the hip and it can go down the thigh. That doesn't necessarily tell you one way or another. On physical examination, if you have significant point tenderness over the painful hip area, that's an indication that it's probably coming from the joint. And also if you have range of motion pain, when you internally and externally rotate the hip, that's another indication it's probably coming from the hip itself. Neurologic examination is not very helpful. Imaging studies, as mentioned, what you see here is what you saw in the cartoon. The spinal canal is more triangular here because of the spinal stenosis. And then what you can see is you have the degeneration with overgrowth. You have the overgrowth of the soft tissue as well. So the MRI is a study of choice. One of the main ways to tell the difference between hip or a spine source of the pain is to do an injection. So let's say you have an arthritic hip and you do an injection of numbing medicine into the arthritic joint. Within minutes you should get pain relief. Okay? And if you don't, then an injection, epidural injection, around the area that you see on the MRI of the spinal stenosis will often give pain relief within minutes as well. Okay, so those can be very helpful for diagnostic purposes. If you get complete hip relief with a hip injection, you know it's a hip problem. If you get complete hip relief with an epidural injection, you know it's a lumbar spine problem. Okay, if you get some relief from the hip injection with the rest of relief from an epidural injection, you know you have a combination of the two. The person has both hip arthritis and spinal stenosis. And there's always the possibility that neither injection will work well. In that case, you got to keep looking to try and figure it out. The top pain management in the Denver metro area is with Colorado Pain. They offer comprehensive medical management as well as interventional treatments. Over 50 insurances are accepted by the board-certified pain management doctors. The docs have won the Patient's Choice Award 5 years in a row, and they have over a 90% success rate for the non-operative treatment and pain relief of all types of pain conditions. The number to call is 720-306-9575, and visit us on the web at painmanagementdenverco.com. I'm Dr. Green with the Colorado Pain Network. Your pain stops here.